Close on the heels of his suggesting that to prevent AIDS, fidelity in marriage was better than use of condoms, this statement on Health Minister Dr Harshvardhan's blog stirred yet another controversy. In his vision document for Delhi schools, he said so-called sex education to be banned. His website drharshvardhan.com also states the need to integrate value education with course content and put strong emphasis on exposing students to India's cultural relations. The minister, who is presently on an official visit to the United States, was quick to issue a rebuttal. He said, "I am a medical professional who has embraced rationalism and I wholeheartedly support pedagogy that is scientific and culturally acceptable." He clarified that the view expressed on the website was entirely his own and made in the context of the UPA government's 2007 decision to introduce the adolescence education program in its original form. Even the chief ministers of UPA ruled states had objected to it and subsequently it was modified. Dr Harshvardhan said crudity and graphic representation of culturally objectionable symbols as manifested in the UPA's so-called sex education program cannot be called sex education. Every education system must strive to have an ideal curriculum, and to that extent my stand is valid. Sex education that builds societies free of gender discrimination, teenage pregnancy, HIV/AIDS proliferation, pornography addiction, etc. should be the goal. On its part, the Congress contested the concept of vulgar sex education, stressing that sex education was an internationally accepted norm.
I'm told just now that he's changed his stance once again to say he did not mean sex education, he meant vulgar sex education. I don't know what does that mean though. Use of condoms and contraceptives, prevention of sexually transmittable diseases including AIDS, which and sex education are part of declared national and international policies.
Activists too hit out at Dr Harshvardhan's stand, stressing the need for sex education in schools.
What is actually sex education? One should understand that. One should clearly define that. One should understand clearly that. Then only you can decide on that. Without any such debates and discussions, you are taking a position. I think that is not a right thing to do.
Dr. Harshvardhan is a health minister, not a social activist or a moral preacher. He is supposed to do his duty, which is look into the health of the citizens of this country. Due to the sex, the children not having knowledge, there is a problem of increasing abortions where young girls are losing their lives. So sex education is a must in schools.
मुझे समझ नहीं आ रहा है ऐसा क्यों कहा, क्योंकि एजुकेशन किसी भी क्षेत्र में, चाहे सेक्स के क्षेत्र में हो या एस्ट्रोनॉमी के क्षेत्र में, बहुत ज़रूरी है. एजुकेशन या इंफॉर्मेशन के खिलाफ कैसे हो सकते हैं? और सेक्स एजुकेशन क्या है? बेसिकली हर बच्चे को उसकी शारीरिक प्रक्रियाओं की सही साइंटिफिक एक्यूरेट जानकारी देना.
The controversy goes back to 2007 when the UPA government attempted to introduce the adolescence education program. Some parts of it were found to be objectionable, so several states did not implement it. The adolescence education program was later substantially modified, after which it has been reintroduced in senior schools across the country to educate students about HIV as part of life skills in grades 9th to 11th. Newsnight Desk, DD News.